Welcome to another Doctors Express Medical Minute.
Hi, my name is Jeremy Allen. I'm the Clinical Director of Patient Services at Doctors Express here in West Hartford, Connecticut. And I'm here to talk to you today about EV-D68 or Enterovirus D68. So Enterovirus D68 is a virus that causes respiratory illness. We've seen a lot of enteroviruses. Typically, if you get a summer cold, it's an enterovirus. A lot of enteroviruses also cause gastrointestinal problems as well as other diseases. This one specifically, though, is really focusing the respiratory tract. Symptoms of EV-D68 are your standard summer cold. In fact, if you've had a summer cold, there's a chance you had enterovirus at some point. It's sniffles, it's cough, congestion, runny noses, sore throats, and then difficulty breathing, especially in children with asthma problems or who are susceptible to breathing issues. They can get more severe versions of respiratory distress. EV-D68 is a disease that we don't typically test for. It's not like strep where we have a rapid testing. It's something that we base diagnosis clinically, and if it's severe, then we can do some very labor-intensive blood tests, but not typical and extremely expensive. Anyone watching this knows that kids are vectors for disease. They don't wash their hands great, so of course we always recommend preventative stuff. Washing your hands, covering your mouth with your elbow when you cough, and keeping your kids out of school if they're sick, especially if they're very sick. The problem is right now we're seeing the majority of this is in the central United States. So Missouri has been like the biggest reporter right now. The farthest north and east for us who live here in New England is Ohio. So it hasn't even crossed into Pennsylvania or even New York yet. But given travel, national travel, school systems, and upcoming holidays, it's not going to be surprising if we see it in New England in the near future. It's a self-limited disease, which means that if you get it, you will get better by your own body's immune system. Some kids, unfortunately, need a little extra help, so that's supportive care. And that can be just from kind of cough medicine and seeing your regular provider, your pediatrician, coming to visit us at Doctors Express. We'll be happy to check you out. But if they're really severe, especially kids with asthma, they might need to go to the emergency department. There's no vaccine for this, and there's no antiviral medicine for this.
This has been another Medical Minute from Doctors Express Urgent Care, with locations in Danbury, West Hartford, Bridgeport, Stamford, and Hartsdale, New York.